Hello, myself Dr. Iman Subdev. I'm a trauma and the joint replacement surgeon. Today, in this video, we will discuss about the knee joint arthritis as well as the knee joint replacement surgery. There are many reasons of the knee joint arthritis, among which the most common cause is the primary osteoarthritis of the knee joint, which is also known as the Sanധിva. Second one most common reason is the rheumatoid arthritis, which is also known as the Gaठियावा. And third one most common cause is the post-traumatic arthritis of the knee joint. Patient having the knee joint arthritis have the difficulty in the walking, sitting, squatting, cross-leg sitting, stair climbing, running. Basically, there are the 4 stages of the knee joint arthritis. In the first 2 stages, patient have the pain and swelling around the knee joint and mild to moderate difficulty in the walking and sitting. On an X-ray, there is minimal reduction of the joint space and the cartilage destruction, which can be better visualized on MRI. In the third and fourth stages, patients have more pain in walking and difficulty in the sitting, squatting, stair climbing. On an X-ray, there is total destruction of the joint space and the cartilage along with the osteophyte formation. So, usually we advise the knee replacement surgery in the third and fourth stages. Here is the X-ray of the normal knee joint on the left side and arthritic knee joint on the right side. You can see how the arthritic knee is looking with obliteration of the joint space on medial aspect more than the lateral aspect. Here is the X-rays of our case with arthritis of the both knee joint more on the right than the left. On the right side, there is total obliteration of the joint space with bone touching to each other along with the osteophyte formation. So we have advised the knee replacement surgery of the right knee. Here is the video of the patients walking before the operation. During the surgery, after the soft tissue release, we usually take the tibia cut first using the special instruments we usually call as a zig, and after the tibial cut, we take the femoral cut. After taking the tibia and femoral cut, we check the limb alignment and the stability of the knee joints using the trial implant and the spacers. This is the image of the bones after cutting, and this is the image of the real implant. And this is the video of the patients walking on the next day of surgery. And patient is usually allowed to walk with full weight bearing walking with the walker as well as a stair climbing on the third day of operation.